Healthcare-associated infections, HAIs, are a significant cause of morbidity and mortality. But HAIs are both tragic and avoidable. This fuels our passion and innovation for creating safer environments of care. This course covers some of the common procedures used to clean patient rooms throughout North America. The procedures included here are general and based on industry best practices. They should not replace the site-specific standard operating procedures, SOPs, used in your facility. If you have any questions about specific tasks or how they're to be done, ask your supervisor. This course covers why proper cleaning and disinfection of patient rooms is so important, how to protect yourself while working in patient care areas, supplies and tools needed to properly clean patient rooms, how to properly clean an occupied patient room. There is strong evidence that the healthcare environment, especially frequently touched surfaces, can play a role in the transmission of healthcare-associated infections. Studies have shown that germs or pathogens can live on surfaces for extended periods of time, and that cleaning and disinfection can play a key role in reducing these pathogens. Many patients who enter the hospital have weakened immune systems. This makes them more susceptible to infection. Because of this, it's very important to ensure that patient rooms are properly cleaned and disinfected each day, and rigorously cleaned and disinfected before a new patient is admitted to the room. Cleaning and disinfection will help protect both the patient and healthcare personnel. Just because a surface looks clean doesn't mean it is clean. Research has shown that frequently touched surfaces such as bed rails and controls and supply carts can play a role in contaminating the hands of healthcare personnel. Contamination of hands can lead to transmission of pathogens to other surfaces or patients. This is why the cleaning and disinfection of all the surfaces in the room, especially the frequently touched surfaces, is critical to patient safety. To protect yourself, it's important that you follow safe work practices and properly prepare before cleaning a patient room or surrounding areas. There may be pieces of equipment or surfaces in patient rooms that are cleaned by other healthcare personnel. Who has responsibility for cleaning each piece of equipment or surface should be clearly defined. It is best practice to have a procedural checklist for all healthcare personnel to ensure that all equipment and surfaces are clean. In healthcare, how you clean is as important as what you clean and how often you clean. Proper techniques help protect you and ensure a safe environment for patients. Here are some reminders on general practices in healthcare cleaning. If time is limited, focus on the highest risk areas like the patient zone first and work outward from that zone. Move around the room in a consistent pattern, either clockwise or counterclockwise, to ensure that no surfaces are missed. Work from high to low. If debris falls from a higher surface when you're cleaning it, you don't want it to recontaminate a surface that has already been cleaned. Use fresh cleaning cloths and mops in each area to be cleaned. As a cleaning cloth becomes soiled or dries out, replace it with a fresh cleaning cloth. Never re-dip a used cleaning cloth into the disinfection solution. Handle waste, soiled linen, and debris as little as possible. Use care not to compress waste and carry it away from your body. Roll soiled linen carefully to limit your exposure and risk. When cleaning or mopping large surfaces, outline the area and then use overlapping passes to ensure all the surfaces were properly cleaned. Separate dirty and clean tasks. Remove all the waste and linen, clean surfaces, and then conduct hand hygiene before conducting a clean task, such as making the bed. How to protect yourself while working in patient care areas. To protect yourself and those around you, it's important to perform hand hygiene, either washing with soap and warm water or sanitizing with an alcohol-based sanitizer before you start a task, and at any time when your hands become contaminated. Germs can be spread through direct contact with an infected person. or through indirect contact with a contaminated surface. When hands become contaminated, you or your coworkers can unknowingly move germs around the environment, contaminating other surfaces or people. This is why frequent hand hygiene is so important, protecting you, your coworkers, and patients. You should always perform hand hygiene at the start and end of a cleaning task. You should also perform hand hygiene whenever your hands become soiled or contaminated, or whenever your gloves are punctured, torn, or removed. And you should always perform hand hygiene prior to eating, drinking, smoking, or other personal care activities. It's important to conduct hand hygiene before entering and leaving patient rooms, and it's highly recommended to conduct hand hygiene before restocking supplies or making the bed. To protect you while you're doing your job, you should always wear personal protective equipment. Personal protective equipment, or PPE, refers to wearable equipment that is designed to protect you from exposure to or contact with infectious agents. There are a number of types of personal protective equipment, including gloves, gowns, face masks, respirators, goggles, and face shields. The selection of PPE is dependent on the task and the potential for exposure to blood, body fluids, or other infectious agents. It's recommended that disposable gloves be worn to protect your hands from possible contact with blood, body fluids, or other potentially infectious materials. It's also best practice to use gloves when handling cleaning chemicals or disinfectants. Gowns should be used to protect your skin and clothing when contact with blood or body fluids is anticipated. Mouth, nose, and eye protection, such as goggles, masks, and shields, are recommended when it's likely that you could be accidentally splashed or sprayed with cleaning chemicals or blood or other body fluids. Finally, it's important to always conduct hand hygiene after removing and disposing of your personal protective equipment. If you're ever unsure about which personal protective equipment is appropriate for your task, check with your supervisor. To make the selection of PPE easier, most facilities have implemented precaution strategies that outline what PPE should be donned in certain situations, depending on the risk and mode of transmission of the infectious agents. Standard precautions are the minimum infection prevention practices that apply in all settings where patient care is delivered. These practices are designed to protect you and your co-workers and prevent the spread of infection among patients. Standard precautions include hand hygiene, use of personal protective equipment, safe handling of potentially contaminated equipment or surfaces in the patient care environment, and respiratory hygiene and cough etiquette. There are other types of precautions beyond standard precautions that are designed to protect you while you work and prevent the spread of infection within the facility. These include contact precautions. These are used when patients are incontinent or have open or draining wounds. When you see this precaution sign, you should wear gloves and a gown when working in the patient's immediate environment or touching his or her belongings. Droplet precautions are used when a patient is infected with a pathogen that can be transmitted via droplets, such as respiratory viruses. When you see this precaution sign and there's a reasonable expectation you could be exposed to blood or body fluids, you should wear a face mask and goggles or a face shield when you're in close contact with the patient or his or her environment, along with gloves and a gown. Airborne precautions are used when a patient is infected with a pathogen that can be spread through the air, such as tuberculosis or chickenpox. When you see this precaution sign, you should wear a respirator when entering the room, along with gloves, gown, and goggles, or a face shield if there's a reasonable expectation you could be splashed with blood or body fluids. Prepare to clean. Before you start the cleaning process, you'll want to make sure that you have all the supplies and tools needed for cleaning patient rooms. Taking the time to properly prepare your equipment and cleaning products will save you time, and make you more efficient during the cleaning process. First, check your workstation or cleaning cart to ensure that all of the cleaning tools that you will need for the job are properly placed, including wet floor signs, dusting tools, and wall washing frames and handles. Next, check your workstation or cleaning cart to ensure that it is well stocked with any consumable items, such as gloves, hand soap and sanitizer refills, towels, liners, and cleaning cloths and mops. Use a chemical dispensing system or measuring cup to properly dilute cleaning chemicals and disinfectants. The proper dilution is essential to ensure that disinfectants and cleaners work properly. Make sure that all cleaning chemicals are properly labeled. Pre-wet cleaning cloths and mops with properly diluted disinfectant solution. Some facilities prefer reusable, launderable cloths, while other facilities prefer disposable cloths. Both options are acceptable. Once these tasks are complete, you're ready to start the cleaning process. Occupied room cleaning, also known as daily cleaning. It's important to clean and disinfect all high-touch surfaces in the patient's room and bathroom each day. This helps reduce surface contamination, which could present a risk to the patient, visitors, or healthcare providers, reducing the risk of infection and improving patient outcomes. Daily cleaning and disinfection also provides patients and visitors with the peace of mind that steps are being followed to create a safe environment of care, increasing patient and visitor satisfaction. A simple 10-step process can be followed when cleaning an occupied patient room. 1. Prepare. Gather supplies and prepare to enter the room. 2. Interact. Greet the patient and gain permission to clean. 3. Remove. Remove waste and linens as appropriate. 4. Spot clean. Spot clean and dust as needed in the room. 5. Disinfect patient care area. Disinfect the high-touch surfaces in the patient care area and the room entrance. 6. Disinfect patient bathroom. 7. Refill. Refill disposables. 8. Inspect. Everything addressed? Anything not working? 9. Floor. Clean the floor in the patient room and bathroom, finishing at the door. And 10. Interact. Thank the patient and ask if anything else is needed. As you prepare to clean the patient's room, ensure that you have all needed supplies so that you can quickly and efficiently perform the cleaning and disinfection tasks, causing as little disruption for the patient as possible. Look for precaution signs to determine the appropriate personal protective equipment needed to protect yourself and others in the facility. Place the workstation or cart at the patient room door and position the wet floor sign to alert others that the room is in the process of being cleaned. Sanitize your hands and put on the appropriate personal protective equipment. Before entering the room, greet the patient and gain permission to clean. Explain that you'd like to clean his or her room and restock all needed supplies. Ask the patient if there's anything they need or if there are any issues you can help address. Give the patient an idea of how much time the cleaning process will take. If the timing is not convenient for the patient, you may need to leave and return later. Be respectful of the patient's health, safety, and privacy at all times. Survey the room. Be alert for sharps or other hazardous objects, and if you do find them, dispose of them safely per facility policy. Ensure that the room is in working order and that no surfaces are damaged. Report any issues to maintenance so that they can conduct repairs. Empty all waste receptacles, including general trash and infectious waste. Remove all soiled linens and replace as appropriate. Contaminated laundry should be handled as little as possible. Use a dry mop or broom and dustpan to gather any large or loose debris from the floor surfaces. Once all waste and linen have been collected, close and properly seal the containers and dispose of them per facility policy. Handle the waste containers with care. Do not compress the waste with your hands. Be sure to handle the containers from the top and carry the waste away from your body. Use a cleaning cloth moistened with disinfectant cleaner to clean and disinfect all high-touch surfaces in the patient's room. Be sure to remove any gross soil and debris from surfaces prior to beginning the disinfection process. As cloths become soiled or dry out, discard the used cloth into the trash or soiled linen container and gather a new cloth. Use care to prevent splashing and dripping. It's important to clean environmental surfaces that are frequently touched or visibly soiled. Move around the room in a consistent pattern, either clockwise or counterclockwise, from high to low, to ensure that no surfaces are missed. The following high-touch surfaces should be cleaned on a daily basis: room door handles and surrounds, room light switches, computer monitors, keyboards, and carts, bed rails and controls, call buttons, cords, and remotes, over-bed tray tables, IV pole grab areas, bedside cabinets and other furniture, telephones, patients' and visitors' chairs, wall-mounted dispensers and holders, and commodes if present. When all the surfaces in the patient room area have been cleaned, you should remove your gloves and sanitize your hands before moving on to clean the patient's bathroom. As you enter the patient's bathroom, flush the toilet and plunge the bowl to remove excess water. Apply the disinfectant cleaner to the toilet bowl, seat, and wall and floor area around and behind the toilet, and allow the disinfectant to dwell while cleaning other surfaces. It's important to clean environmental surfaces that are frequently touched or visibly soiled. Move around the room in a consistent pattern, either clockwise or counterclockwise, from high to low, to ensure that no surfaces are missed. It's also best practice to clean from high to low and from cleanest to dirtiest surfaces. Toilets should be cleaned last. Use a cleaning cloth moistened with disinfectant cleaner to clean and disinfect all high-touch surfaces in the patient bathroom. Be sure to remove any gross soil and debris from surfaces prior to beginning the disinfection process. As cloths become soiled or dry out, discard the used cloth into the trash or soiled linen container and gather a new cloth. The following surfaces should be cleaned in the patient's bathroom: the bathroom door handle and surround, the bathroom light switch, the bathroom sink, faucet, and faucet handles, mirrors, vanities, and exposed plumbing, the towel and soap dispensers, showers if present, handrails near the toilet, bathroom pull cords, the toilet flush handle, the bedpan cleaner, the wall area surrounding the toilet and toilet base, and the toilet seat and bowl. After completing the cleaning process, remove your gloves and wash your hands with soap and water or sanitize your hands and put on new gloves. Check all towel, tissue, and hand hygiene dispensers. If required, refill these dispensers. Reline the linen and waste receptacles using the proper colored liners. When all these steps have been completed, inspect the room to ensure that all steps have been completed and all the furniture has been properly placed. Make sure the patient room looks clean and presentable, and all mirrors and glass are fingerprint-free. Clean the patient room and bathroom floors using a microfiber mop pre-wetted with cleaner or disinfectant. A fresh mop should be used for each patient room. If there is significant debris on the floor, you may want to dry mop or sweep prior to wet mopping the floor. Work from the far corner of the room towards the door so that you finish cleaning the floor at the room entrance. Remove all of the supplies that were used to clean the patient room, properly disposing of used cleaning cloths and mops. Disinfect all of the cleaning tools that were used prior to putting them back on the workstation or cart. Let the patient know that you're now finished. Ask them if there's anything else you can do before you leave. Thank the patient for allowing you to clean his or her room. Personal protection is as important at the end of a cleaning cycle as it is at the beginning. When you've completed all of these tasks, remove your gloves and other personal protective equipment and dispose of it properly before performing hand hygiene, either hand washing or using an alcohol-based sanitizer. Daily cleaning of occupied patient rooms is an important component of providing a safe environment of care. High-touch surfaces in the patient care area can become contaminated, and that contamination can be spread directly or indirectly to occupants or visitors to the room. Cleaning and disinfecting these high-touch surfaces has been shown to reduce surface contamination, thereby reducing the risk of infection. Occupied room cleaning typically consists of 1. Preparing to clean, gathering supplies, putting on PPE, and preparing to enter the room. 2. Interacting with the patient to request permission to clean. 3. Removing waste and soiled linens. 4. Spot cleaning visible soils. 5. Disinfecting the high-touch surfaces in the patient care area. 6. Disinfecting the bathroom. 7. Refill disposables. 8. Inspecting the room. 9. Mopping the room floor and bathroom floor. And 10. Interacting with the patient as you leave the room. When you've completed all of these tasks, clean up and remove all supplies and remove your gloves and other personal protective equipment and dispose of it properly before performing hand hygiene.